Hello, everyone, and welcome to Africa Fire Mission's weekly virtual training session. My name is Mike, and I'm the programs director here at Africa Fire Mission. We're so happy that you took time out of your busy schedules to join us for today's training. Today, we're going to be taking a look at some really simple first aid practices that are handy for first responders. We also want you to think about taking some of these first aid practices and teaching them out to the community as well. We'll be putting together some resources for you to do that a little bit later on in the year. Keep your eye out for that. Before we get started with today's training, I'm going to pass things over to Jose. Jose is Africa Fire Mission's Fire Safety Officer. He's going to start us off with a few words of encouragement.
Thank you so much, Chief Mike. I truly appreciate you and always being there every Wednesday. We don't take that for granted. And for you, my fellow firefighters and first responders, thank you. Thank you for always being here and just being ready to respond. Right now, the fire season is actually here with us. And when I mean that, in schools, let's be ready that there's some schools which are going to start burning their dormitories. Unfortunately, that is what is usually the trend when second term reaches, because of various reasons of maybe ASON or they don't want to have exams and things around that. This week, the last 2 weeks here in Madare, there's been a lot of fires. We've had a very tragic fire that killed about 5 people. And just this morning, there was another fire that erupted. And at some point, we might get discouraged, like, hey, we are doing so much, but then there's so many more, there's so much fires that are arising. Listen, guys, what is being reported is actually the fires that are burning. But then, can you imagine with the reach outs that we do, the fire reach outs that I've been seeing on the first responders page, the Facebook pages in the networking group on Facebook, how much fires have we saved, or how many lives have we saved that are not reported? Many. So just be encouraged. Don't feel like you're doing nothing when you're going to so many fires and guys are saying, hey, either you came in late or hey, it was so overwhelming on that fire. You go back to the firehouse really tired and frustrated. You are doing a good job. There are so many lives that you have saved that are that are not being reported. So stay encouraged, stay ready, and keep on training in the firehouse, because you know what? At the end of the day, you are serving God's creation. God bless you and keep you. Back to you, Chief Mike.
Thank you, Jose. We appreciate those encouraging words and all the work that you're doing to try to help build the fire service throughout all of Africa. It's much appreciated. Before we get started with today's class, let me just touch on a couple quick administrative notes. Whatever you'd like your certificate, if you stick around, right, for today's class, stick around for about 70%. It's usually 40 to 45 minutes. We'll get you to that mark. You can get a certificate of attendance for today's class. Um, Whatever name you'd like to see on that certificate of attendance, make that your screen name here. That's how the system works, all right? So if you need to make an adjustment to your name on the screen, go ahead and do that. That'll reflect what your certificate's going to read. If you have more people watching on your screen than just you, my email I just dropped in the chat there. Go ahead and send me an email with a list of the names of the people that are watching with you, and I'll make sure that they get their certificates as well. Uh, I think at this point in time, I'm going to sort of swing right in. Let me invite you to stick around when we get done at the top of the hour. Uh, we're going to switch over into our tea time. Okay? And tea time is a time where you can network with other firefighters from throughout Africa. You can ask questions about today's training. It's just a really good opportunity for you to share what's going on and to learn from your fellow firefighters that are working in the same conditions and the same situations that you are. So, top of the hour, if you've got the bundles, please stick around and join us for that. So far as today's lesson, today we're going to be looking at what I'm calling this class is simple first aid. We're going to touch on a couple of simple topics. They're going to be handy for you as a first responder if you encounter someone that's got one of these issues. This is really basic stuff, but the thing that I want you to take away from this is to think about how you could educate your community with these simple first aid practices as well. And this goes hand in hand with the fire prevention stuff that Jose's talking about, right? We're dealing in many places where we're working, right? Where you guys are working, we're dealing with um, uh, uh, limited resources in equipment that we have and things like that. Uh, we've got limited fire trucks. We've got limited ambulance services, right? We don't have access to that good, rapid, quality medical care. And that, you know, that's not an insult to those of you that are working that EMS, but there could be more of you with better training and better resources and better tools, right? So just like that fire prevention, uh, you know, those first aid practices can really help out. So, you know, why is this important? Why is first aid important? Who should be learning the first aid? Certainly, you guys, as first responders, you should definitely have the basics of first aid sort of mastered, right? Um, but there's other people that should have those first aid skills, right? The general public can have those first aid skills. Um, School children, right? If once they get to a certain age, and you know it's sort of different in every area, but you get of a certain age, um, where they can handle sort of the little bit of stress that comes with dealing with these things. We could be teaching school children this as well. Like I said, we're working on putting out a curriculum. Of course, Africa Fire Mission, if you go to our webpage, www.africafiremission.org, we have lots of resources, free resources available there for you for fire prevention and things like that. In the next couple months, we're going to be releasing some resources for first aid training as well, so that you can go out into the communities and provide some basic first aid training. So what we're going to do today is we're going to do this sort of first aid curriculum. There's 6 different lessons that we've got prepared so far. I'm going to skim over some of them because of you guys' experience, right? So this month on the virtual training here, we've been doing first aid, we've been doing EMS type stuff. We've hit on the scene safety every time. Let me just touch on it lightly here, and then we're just going to move right on. There's a whole lesson that we'll have for you for scene safety. But what are the basics, right? Situational awareness, being aware of what's going on, what hazards are there, what caused the problem in the first place. Um, what kind of dangers are presented to me as the rescuer. If I'm going to render aid to someone, you have to protect me first because I can't help anyone if I get injured. So I'm looking out for me, anybody else that's helping me. We're going to get there and help out the patient. Situational awareness. We've talked about this. Boy, we talk about it almost every training we do, right? Because it falls under every topic. PPE, you know, be sure that you're protecting yourself from the blood and guts, right? Bodily fluids, things like that. If you've got gloves, put gloves on. If you don't have gloves, can you use something as a barrier between you and that sort of icky stuff that you might encounter? Good hygiene practices afterwards, okay? Once we've identified, checked out the scene, the situation, we've got our PPE in place if we have it. Now we're going to try to control that scene a little bit, mitigate some of those hazards, whether it be traffic or what have you. And of course, you're going to call for help. As first responders, do we need to call for help? Sure. You know, we can't do it all. Do you have the ability to, if you're walking in the market and somebody, you know, falls and hits their head and starts bleeding, you don't have the, you know, you don't have the means to transport them somewhere. So you got to call for that help. Be sure you know what those emergency numbers are. We're going to move into our first, you know, topic here. The first topic we're going to touch on today is choking. Um, there's lots of different ways, you know, that you can prevent choking, right? Um, you know, be sure you're cutting your food into, into small sort of bite-sized pieces. Large chunks of meat, if you're not chewing them well, that can cause choking. Um, uh, Children playing with objects in their mouth or running and playing with food in their mouth. Um, uh, Small children, babies, given harder foods and they're not being watched while they're eating, they can inhale something and get something stuck in their throat and choking, right? Small toys given to very young children, they put in their mouth. So lots of different ways that people can choke and you can try to avoid some of those situations. How do we know if somebody's choking? How can we identify that choking victim, right? Well, we've got two different sort of choking situations that we encounter, a partial airway obstruction and a total airway obstruction. In a partial airway obstruction, at first the person's going to be coughing, they're going to be trying to speak, but maybe they can't speak clearly, but they're still coughing. That's a partial airway obstruction. When it becomes a total airway obstruction, the person won't be able to talk, they won't be able to cough, they won't be able to make any types of sounds. And while I'm talking about this, my hands keep going up to my throat because that's just sort of the natural reaction that people have, right? Their hands will go to their throat when they're choking. So they're sort of, signaling. So what do we do if someone is choking, right? The partial airway obstruction, the main thing we're going to do is to just encourage them to keep choking. If the person's making sound or if they can talk a little bit, that means that they can breathe. And as long as they're still breathing, they're doing all right. Let them try to work it out on their own. Encourage them to do that forceful coughing so that they cough up whatever they're choking on. If it progresses further or they're already beyond that and they've got that total airway obstruction, uh, you want to call for help. Try to get an ambulance started on its way. And then you use what's called the Heimlich maneuver, right? And maybe we've all heard this, maybe we haven't. It's pretty simple maneuver to do. Stand behind the person, wrap your arms around their waist, and you place your fist with your thumb pointing inward into their abdomen, about middle of their abdomen, just above the navel, but just above the belly button, right? And rapidly with your other hand, pull in, forcefully pull in, thrusting into that abdomen, right? What we're trying to do, we're forcing the diaphragm to move up, forcing air up out of the lungs, trying to expel that whatever's lodged in their throat, trying to get them to expel it out. Those forceful thrusts from behind. Um, Give rapid thrusts in and out, uh, and basically you keep doing that until that item comes out. What if it doesn't work, right? If it doesn't work, or if they pass out, what can you do? You know, there's where you can lay the person down on the ground. You're gonna ask them if they're okay. Try to get a response. At this point, you're probably not. Look, listen, and feel for breathing. Get your face down there um, close to their mouth. See if you can feel them breathing. There's no breathing. They're laying on their back. Now we're doing these abdominal thrusts where now you're going to get on top of the person and give those abdominal thrusts. Instead of from reaching around behind the person, you're going to be down there on the floor with them. Giving those abdominal thrusts, you're going to give 5 of those abdominal thrusts and then sweep the mouth with your fingers, trying to see if that object came out and see if you can remove that. You're going to continue doing that until it's effective or they cough that thing up and out. Uh, Things are just a little bit different when it comes to a child and infants. Um, with the children there, um, a small child, you can sort of, if you take a seat, right, lay them down, head down over your knee, so you can sort of supporting their chest, as you can see in that picture, and give them what we call back blows, where you're sharply hitting between the shoulder blades until the object comes out. Okay. Typically, with the children, you don't do that sweep of the mouth unless you can see the object. So you're going to look into the mouth, see if the object came out, and if it is, finger sweep. Babies, similar positioning to the child there, but now with that infant, you're kind of laying them down on your forearm, supporting their head and sort of chin with your hand, and you're giving those strong back blows to the back to dislodge whatever they're choking on. Okay, uh, so pretty simple. Anybody can do these skills. Very easy to teach to someone. Can solve a simple problem like someone's choking. It's so simple to some extent, you can even do it yourself. You can do what they're calling a self-rescue, where you're actually going to use the back of a chair, or you're going to use, the edge of a table and give yourself those abdominal thrusts to try to help dislodge whatever that is that's in your throat and you're choking there. So, uh, in the big picture, that's it. That's choking. That's first aid for choking, right? Um, Moving on to our next topic, and of course, if you were teaching this, now's the time, right, to do some in person, right? You're going to do some practicals and practice the positioning things. Moving on to cuts and lacerations. Um, sort of knowing some of the differences of what you see, right? Here we've got some examples of a bruise or a scrape. These are, minor injuries. A bruise indicates that there's some bleeding under the skin. The color kind of changes over time, right? A scrape is an abrasion. It's some damage to the skin. It can get painful. It can get infected, but it's not, rapid. There's not, much blood loss with these. What do you do for these things if it's a little bit more severe than that? These scrapes and bruises, there really is no treatment, specific treatment for these, right? Keep the area clean. The scrape, you can rinse out any debris from it, wash it with some, soap and water. You can apply um, if you've got, like a sterile alcohol solution or some betadine or one of those, treatments, you could wipe it down with that, but really doesn't need a whole lot of first aid or care. And what if we've got a bigger cut or a laceration that's bleeding a little bit more? What do you do for these minor cuts? And we're not talking about severe bleeding, severe active bleeding. We talked about that a couple weeks ago with our active bleeding control training. But this is the minor stuff, where the person's not really seriously injured, but they do need just a little bit of help. What do we do with it, right? Cover it with a bandage. If you don't have a bandage, use a clean cloth. Apply firm pressure uh, to the area that's bleeding. Hold that pressure on there until the bleeding stops. If the bandage that you're using becomes soaked in blood, you can stick another one on top of that. We don't want to pull any bandage away from the wound because as you put that direct pressure on, that blood's going to start to clot right there. And those clots can stick to the bandage or the cloth. So you don't want to pull those back off. That might make you, start over again. Okay. So put some pressure on it. If you can, raise that limb above the level of the heart. That'll also help to slow the bleeding down. Once you've got that bandage on there, if you've got like a rolled bandage or something that you can wrap around it to hold that bandage on, there you go. There's your treatment for these minor cuts and lacerations. If you can't control the bleeding just with those simple methods of putting a bandage on it, continue to keep that pressure on it. But you got to get that person for medical treatment. Ambulance, take them to a clinic, take them to a hospital. Okay. Of course, be sure you're washing your hands if you can, washing your hands thoroughly, certainly after you're providing that first aid. If you can get them washed or cleaned before you start doing that as well. Not a bad idea. All right. When do you need stitches? Okay, how can you tell if you need stitches from a doctor? Couple different ways, right? The bleeding doesn't stop. Uh, Situations where you need it bites, whether it be an animal or a human bite. If bites that break the skin, those should be sutured or stitched up. If some sort of large object was in the wound, whether it was a knife blade, whatever, that impales you or something like that, you're going to want to go to the doctor for stitches. If it's a deep wound, if that cut is deep enough that you can see muscle down inside, or more so you can see bone, okay, need stitches, okay? And then if you're looking at that cut and you think, that's probably going to leave a scar, you should probably get some stitches, okay? And a cut or a laceration that receives some stitches from a well-trained person, some tiny small stitches can really reduce the scarring. So, if you're concerned about scarring because it's a cut or laceration on the face or something like that, there's where you want to make sure you get to the doctor and get some stitches. Okay. What about aftercare, right? Normally we don't talk about this a lot as first responders, but important information for you or for the community. What do we do after? We've got the bleeding stopped on these minor cuts and things like that. We put a bandage on it. We held pressure until it stopped bleeding. What's the next thing, right? Well, the next step would be to clean the wound, um, wash it with some clean water, mild soap and water. If you've got some sort of antibiotic cream available, a gel or cream, apply that to it. uh, Keep it clean and bandaged. For certain types of cuts or lacerations, particularly punctures, bites, or dirty wounds, you may need a tetanus shot, which means you'll have to go to a clinic or a hospital for that tetanus shot. Okay. Going just that one more step further, um, if you don't take good care of that cut or laceration as the time goes by, that wound can get infected. All right. How do we know if a wound is infected? Well, it's going to be inflamed. There's going to be some swelling. It's going to be red. Uh, it's going to be warm to the touch. It's going to be very tender. If you bump it, it's going to be painful. Okay. Signs of infection. Maybe there's some pus in the wound. So if you look at this particular image there, it's just a little fingertip, but you see that yellow spot there in the center. You see how it's red and irritated, but it's sort of healed over. This is an infected wound, okay? What are you going to do with that infection? Clean it out, soak in warm water, applying an antibiotic cream. Here in the US, one of the names of it is a Neosporin. I'm sure there's different names where you're at, right? Um, Sometimes that antibiotic cream will be enough to treat that infection that you've got. Well, how do we know if we should go to the doctor or go to the clinic, right? Well, if it doesn't improve, if it's getting worse, you got to get medical care, all right? If you've got a fever, elevated temperature, you feel hot, you feel like you're burning up, definitely a sign you've got an infection. You need to get to the hospital for treatment. If you've got some streaks, if you can start to see some red streaks spreading out from that wound, another sign of infection, get yourself off to the doctor and get that medical care. All right. Uh, that's simple first aid, cuts and lacerations. First aid, a little bit of aftercare. with that. Our next topic is fractures. We talked quite a bit last week about fractures, so we won't spend a whole lot of time on it here this week. Um, but, what is a fracture, right? We've got two different types of fractures. We've got closed fractures and open fractures. Uh, with a closed fracture, the bone's broken, but it's still in place below the skin. The skin's not broken in any way. And then you could break things down a little bit more on those closed fractures, where we've got what we call a green stick fracture. And a green stick fracture, the bone is broken but not completely. Okay, so it's sort of like it's cracked, or the name green stick comes from, imagine taking a nice green living branch off of a tree and you try to break it. You can't break it clean. You can't snap it off. It sort of fractures and splinters. That's your green stick fracture. Your simple fracture is that clean break where the bone separates, but again, closed fracture, it's this, there's no open skin wound with it. Open fracture, the name describes it, right? The bone is fractured and it's open. There's some bleeding. It's broken through the skin. All right, so we treat those. We're going to treat these just a little bit differently. Certainly, an open fracture is more dangerous, or more serious, not dangerous. It's more serious. Okay. And because of that open fracture, uh, that opens the door for infection, like we were talking about with those cuts and lacerations. So chances of infection are somewhat low with that closed fracture, but with the open fracture, now we're concerned also about infection down the road. How do we tell if the bone's broken? Okay, well, it's going to be painful. Okay, breaking bones is painful. The person's going to be experiencing a lot of pain. The area near where that break is going to be very tender to the touch. Um, it's going to hurt to move it. If you as you try to move it around, you're going to feel a lot of pain. If it's not an open fracture, right? The area may be swollen or red, because you may get some bleeding, internal bleeding from that closed fracture yet, so you may see some swelling, there's some redness there. Obviously, if it's an open fracture, there's going to be a skin wound. You may even see the bone sticking out of the skin if it's a severe open fracture. Pretty obvious when we see that broken bone itself. What kind of first aid do we have for fractures? Really, it's pretty basic. The first thing is, if it's a open fracture where we've got that open wound, we've got to stop that bleeding. I think Richie had mentioned it last week, during last week's training, phrase in there, splinting. I think it said something, splinting someone to death or something like that, right? What that meant was that if you focus too much on that open fracture of working on putting a splint to immobilize it, but they were openly bleeding, they could bleed to death, right? So stay focused, get on those open fractures, stop that bleeding first. We just talked about that under the cuts and lacerations section. For bones that are broken, excuse me, we want to stabilize them and immobilize them. Okay, so the very basics are just going to be immobilizing it. How can you do that? Buddy taping is one way, especially if it's just a broken finger or something like that. In this example, you just tape that finger to the one next to it. That acts as your splint, takes care of it. Broken fingers, not a whole lot to do with them. So, buddy taping or something like that. You can also do that buddy taping with a leg fracture as well. You can tie the two legs together. Um, the basic key to splinting, you're going to get something sturdy and something stiff. Uh, Place it on either side of the where that fracture is and secure it, right? Um, Pretty basic, pretty simple. Depending on where that break or that fracture is, you may need to immobilize the joint above or below it. Um, so, uh, extend that splint out a little bit past the area where the fracture is. You can use boards, stiff cardboard, rolled up magazines, newspapers, pieces of wood, whatever you can find to make that. Okay. If you have the opportunity, pad it a little bit to try to make it more comfortable, especially if you're talking about an arm splint. You want to try to pad that. Make sure that they're not tied too tight so there's still good blood circulation. Make sure when you're splinting, fingers and toes are still warm and still, have some color to them. Um, Other ways that you can immobilize a fracture is that arm sling. You're just using a cloth um, to hold that arm in place, across the front of your body. Um, that's helping you to immobilize that upper arm so that you're not moving the lower arm. You can just tie some cloth back around the neck and place the arm inside there. Pretty simple. The triangle bandage that we use in first aid for a lot of different things is really handy for making that arm sling. Okay. So that's your care for fractures. Splint them, and of course, anytime you've got confirmed that broken bone, you got to go to the hospital or the clinic to get that casted, so that you don't do further damage, so that the bones are aligned properly. And that's beyond the scope of our first aid practice. So, have a fracture, they got to go see the doctor. Okay. Those are fractures. We're doing okay on time here. We're going to move on to burns. Okay. Uh, Burns, there's a couple of different, we used to call them degrees. They're sort of moving away from that system, going to the sort of named system here, but with we used to say, or sometimes still do, right? First degree burn, second degree burn, third degree burn. They've got some different names for those now. A first degree burn can also be referred to as a superficial burn. Okay. Um, it's red, it's painful, but it's dry and there's no blistering. You can get a first degree burn from the sun. Okay, sunburn is a first degree burn. Typically burns from hot liquids or steam. You could get a first degree burn from a chemical or something like that. Electricity can give you a first degree burn. Red, painful, dry, but no blisters. Okay, lowest level of burns. Next, we come to that second degree burn that we're going to call a partial thickness. Well, thickness of what? We're talking about the skin. Okay, the thickness of the skin. Not the full thickness of the skin has burnt, only part of it. It's red. This time there's blisters. It's the area that's burnt is swollen. It's painful. Okay. More serious, we're going to have to do a little more to treat it. Okay. Then we get to our third degree burns, what we're calling a full thickness burn. This is burning the full thickness of the skin. You'll know these when you see them. If you can't quite picture it, you'll know it when you see it. There's damage to muscle, maybe even there's damage to bone. If it's a really severe burn, the burn site, the skin is white and or charred. Um, and with a third degree full thickness burn, uh, there's no feeling in that area because those nerve endings have been burnt off. Okay, but burnt out. So third degree, very serious burn. Okay. How do we treat these burns? Um, Minor burns, so we're talking first degree, second degree superficial or partial thickness burns, you've got to cool that burn somehow. Okay. You want to cool that burn with cool water, not cold water. Okay. Not cold water, but Cool, clean water. Um, Ideally, you'd like to hold that under uh, some cool running water for 5 to 10 minutes, okay, to try to stop the burn, get the skin cooled off. All right. After we've cooled the burn, if it's in a place where you can't, pour that water and you've got a burn on the face and you can't pour water over it, you can wet a towel or something, put a cool wet towel over it to try to cool that burn off. Okay. If you've burnt something as simple as the inside of your mouth, uh, again, sipping on a cool drink or a piece of ice in the mouth can help with that. All right. If they've got a burn, you want to remove any rings that they may have or anything that's tight on the skin. Remove them sort of quickly and gently when the burn first happens, because that burn there's going to be some swelling in the area of the burn, right? Uh, Apply a burn cream. Uh, be cautious as to what you're applying. I should have mentioned this back with the cuts and lacerations as well. There's lots of treatments that people have. Um, Maybe you've heard, if you get a cut, that you should pack a cut with tea leaves, or that should pack a cut with salt. Those are things you should not do. That we don't want to put anything into cuts or lacerations, right? Some of the things that you may have heard with burns is that you should put toothpaste on a burn. Uh, there's some people that tell you should urinate on a burn. There's all sorts of these different things. These are not recommended. The only thing that we want to put on a burn is a cream that's specifically designed for burns. There's a picture of something there. It's a gel. It's got aloe in it, aloe vera, and it's got lidocaine, which is a numbing agent to help with the burn, right? So some sort of specific burn cream, or some type of lotion with an aloe to on these minor burns is okay. And then you're just going to loosely cover the burn. But none of these, we don't want to put corn flour, maize flour on a burn. None of that. Burn cream or a lotion. Lightly cover the burn. These are your minor burns. That's the treatment for your minor burns, okay? What if it's a major burn, that full thickness burn, that third degree burn? You got to call for help. Um, Third degree burns, full thickness burns are dangerous to the person's life. They can be life threatening, okay? So we're calling for help. They're going to have to go to the hospital. We're going to try to protect them from further injury. Some sort of serious event had to take place in order for you to get that third degree burn. So figure out what caused that. Be sure that they're safe from that. Monitor their breathing. Make sure that they continue to breathe. If they stop breathing, then we've got to go into all of those different interventions that we've talked about in previous months. Um, Similar to those minor burns, if there's jewelry, a belt, anything that's tight, very tight clothing, we want to remove those items uh, from the person. Okay, we'll cover the burn area with these major burns. Um, we're not we're not cooling them. We're not flushing them with water or anything like that. We're just going to cover it. Maybe we're going to try to raise the burned area if we can. Uh, we're going to watch out for symptoms of shock. A person going into shock, they might get pale, cool, clammy skin, dizzy, nausea, feel like they're going to pass out. Those are all signs of shock. You may need to lay them down, elevate their feet to try to treat that shock. But again, major burns, serious burns, full thickness. We can see muscle, we can see bone. The skin is actually charred. Maybe it's white. Serious burns, we've got to get them to the hospital rapid transport to the hospital for those. Don'ts for burns, we talked about this a little bit earlier. What shouldn't you do? Um, you know, uh, let me go back just a minute to that, to those major burns and how other ways that we can identify that. Um, the skin is dry and leathery. It's got those charred patches on it. But then we also look at the size of the burn as well. Um, if it's a larger than about 8 centimeters in diameter, so about 3 inches, the burn is bigger than that, we want to take them for medical treatment. If the burns cover the hands, the face, the groin, those are times that we want to take them for medical treatment, irregardless of what the what degree it is. If it's a second or third, they should still go for medical treatment. Burns on the face, groin, and hands. Um, if the burn is complicated by smoke inhalation, right? So not only are they burnt, but they've inhaled a bunch of smoke. That's going to compromise their breathing and their respiratory system. We got to get them transported to the hospital. They need care by a doctor. If they get burnt and the swelling, and it swells very quickly, another sign this burn is serious enough that we need that medical care. Okay. What shouldn't we do for burns? What are the no's with burns? We touched on these earlier already, but it's worth repeating. Don't cool it with cold water, just a cool water to help stop that burn. Um, if the skin has blistered, we don't want to break those blisters open. If you break open the blister, that's opening the door for infection, like we talked about earlier with the cuts and lacerations. I did tell you to remove those tight items, jewelry, or tight clothing. Uh, but uh, if the clothing is burnt into the skin, then you don't want to remove the clothing. If the person is wearing clothing that's made out of a synthetic material, um, you know, polyester, nylon, any of those types of materials, anything that's not made of natural fibers, when it's exposed to heat, that clothing is going to melt onto and into the skin. If the clothing is melted into the skin, into the burn, you don't want to remove it. You don't want to peel it away. Let them do that at the hospital. So if you go to try to remove the clothing in the area of the burn and it's stuck to the skin, stop, leave it, get them to the hospital. Okay. Then there's all of these home remedies, let's call it, that you may have heard for burns. We don't want to do these. No toothpaste, oils, flour, um, whatever it may be. Sticking to the burn gels or lotion is all we're going to put on. Okay. So that's burns. Again, pretty simple to treat. Um, this stuff's pretty easy to teach. We'll share these slides with you guys um, as well so that you've got them as a little bit of a resource available to you. Final topic I want to touch on today is heat illness. Okay. Um, Heat illness comes from a variety of different causes, but sort of the big picture to this is that the body gets heated and can't release the heat. So you're building up too much heat in the body, and the body can't get rid of that heat. Um, we release heat from the body. The main way, right, that we release heat from our body is when we sweat. Okay, so as we work and we get active, you begin to sweat. The sweat comes out onto the surface of your skin, and that the sweat evaporating off of your skin cools the body down. Okay. So when we get into a situation with heat illness, The body's getting to the point where it can't get shed that excess heat and starts causing other complications. Heat illness can be life-threatening. Okay, it can cause damage to the brain. It can cause damage to your internal organs. So it's something that we've got to take pretty seriously. Uh, how does it happen? If there's high temperatures, and I know that that's very relative uh, to the individual, and that's what's interesting about heat illness. When I travel and work with you guys in Africa, um, the weather that you tell me is cold seems very warm to me, right? So living in a hot environment, and some of you guys that are joining us from the Middle East, boy, do you guys know about the heat, right? You get exposed to a lot of sun, but the longer you're working there, right, the more you get used to it, right? Your body acclimates to that heat, and somebody who's been working in that hot environment can do it for longer than somebody who's not used to it. So that's where we'll see this heat illness impact people differently. I may start to suffer symptoms of heat illness before you all do because I'm not used to working in an environment that's as warm as you guys do. Okay. Humidity plays a factor into that, how much moisture's in the air. When there's high humidity, there's lots of moisture in the air, uh, you suffer the effects of heat illness sooner than when it's very dry out. Because in a dry heat, your sweat evaporates right away and provides that cooling system for the body. If the humidity is very high, that sweat doesn't evaporate off of your skin and doesn't give you that cooling impact. Um, Physical fitness really plays into heat illness. Okay, trying to do a lot of strenuous work or activity when you're not in shape, doing that strenuous work or exercise in the hot environments. Sometimes it's caused by just working too long out in the heat. All right. Then you factor in other factors like poor hydration. So you haven't been drinking enough fluids. Your body's sweat out most of the fluids that are available, so you can't sweat anymore because you haven't been drinking enough fluids. All right. And then there's all sorts of other personal factors, age, obesity or being overweight, alcoholism, other types of health problems, even some medications that people may be taking may make them more susceptible to these heat illnesses. How do you deal with the heat illness, before it happens? Um, you know, Try to avoid working in the high temperatures. If there are fans available, use some fans to keep the air moving. Try to work in the shade if possible. Try to stay out of the sun. Sometimes it's just getting acclimated to that hot environment. So, when I come over and work for a couple weeks, by the end, I'm used to working in that hot weather. It doesn't bother me as much as it does when I first arrive. Um, and then physical fitness, right? The better your cardiovascular health is, the better shape you're in physically. That helps to mitigate these heat illnesses as well. There's two different categories of heat illness that we're going to talk about. We're going to talk about heat exhaustion, and we're going to talk about heat stroke. Heat exhaustion is the lesser of the two, not as serious. What do we do if somebody starts, uh, you know, this heat exhaustion has come because they've lost too much water, they've sweated out too much water, or they've sweated out too much of the salts, right? Salt is an important part of your diet. So if you sweated that all out because of heavy sweating or you haven't been drinking enough, that can cause this. It can start suddenly where all of a sudden you're dizzy and you're not feeling well, or it can gradually start working, but all these impacts start when you're out there in the heat. How do we tell if the person's experiencing this heat exhaustion? They're going to have their skin might be cool and moist, but maybe they've got what we call the goosebumps, right, on the skin. But it's hot out, but their skin's showing those goosebumps all over, right? Um, they're sweating maybe more than they should. They're feeling faint, dizzy, tired. If you take their pulse, it's very weak. It may be very rapid. Um, their blood pressure drops when they stand up. Maybe they're nauseous, they're vomiting, they've got a headache, um, dry mouth, they're extremely thirsty. As it progresses, they might have some confusion. Maybe they're drinking a lot of fluids, but you're not urinating, right? Water in, water out. If you're drinking water, but you don't have to urinate, it means you're sweating it all out. Maybe you're starting to experience this heat exhaustion. What are we going to do for it? Get them in the shade, get them out of the direct sunlight. Um, if there's an air conditioned space available, try to move them into an air conditioned space. Maybe that's a vehicle that has air conditioning, or a some sort of indoor space with air conditioning. Get them to lay down and raise their legs up, sort of like you're treating someone for shock. If they've got heavy clothing on, maybe they're overdressed for the weather. Remove that heavy clothing, remove any tight clothing that might be preventing them from effectively sweating. Get them to drink some cool water, or some type of, we call it a sports drink. You know, some sort of, sports drinks have electrolytes and salts in them to help keep you hydrated. Um, cool water. You could cool them with some water, sort of as artificial sweat. Use a fan to fan them to get that water evaporating off the skin, and just keep an eye on the patient. If you've got heat exhaustion, that's typically something that if you get them cooled off, you get them hydrated, they're going to be able to recover from that. Okay. Heat stroke is more serious. If the person's experiencing heat stroke, there they've got that extreme confusion. The body temperature is up there. They can't get it cooled off. This is the damaging one. Heat stroke is where you can get brain damage, damage those internal organs. They've got to be, they got to get them cooled off, and you got to get them treatment. Um, if you take their temperature, they're going to have a fever over 104. Um, they're not thinking straight. They're acting odd. Their speech is slurred, nausea or vomiting, rapid pulse, headache, fainting. They may have a seizure. They may even fall into a coma when they're experiencing heat stroke. Okay. So, much more serious than the heat exhaustion. Here's where you're going to put them in a tub of cool water, get them into the underneath of a cool shower, spray them down with a hose, use a sponge with cool water. We got to get that person cooled down. Maybe that means finding ice packs, packing those ice packs, or at least cool wet towels under the armpits, on the neck, in the groin. Those are areas where the skin is thinner. There's lots of blood vessels and capillaries close to the surface. Armpits, neck, and groin, getting them cooled off. So long as they're conscious, again, getting them to drink some sort of a chilled drink. I know you guys, you Africans, you don't like your drinks cold. All right, find some cool drinks that have been refrigerated or something. Cool water, cool sports drink or something like that. Keep an eye on the patient, because as this heat stroke really progresses, you may need to begin CPR. Okay, it can get that serious where the heart stops beating, where they stop breathing. Okay, heat stroke, pretty serious. You got to get them rapidly cooled off, and you got to get them transported to the hospital to make sure that there was no permanent damage. Okay, we're coming up right against our time here. It's 10 o'clock. I threw a ton of information at you, but was it really all that complicated? We could wrap that up really quick, right? If somebody's choking, we need some form of abdominal thrust. Encourage them to cough it out first. If they can't cough it out, some sort of abdominal thrust to get that out. Simple. Choking fixed. What if they're bleeding? Some direct pressure and a bandage. A little bit of aftercare, keep it clean, put some antibiotic cream on it, watch out for infection. If you get an infection, go to the hospital. Um, what was next? We did choking, cuts and lacerations, uh, uh, fractures. Okay, if we've got a broken bone, if there's bleeding, stop that bleeding first. Uh, Immobilize that fractured bone with some sort of a splint or sling and get them transported to the hospital. Pretty easy. Burns. What do we do with the burn? Cool it, keep it clean. Depending on the seriousness of it, we're going to go to the hospital. Burns, keep them covered. Put some sort of a burn cream on them. Monitor them, case of infection or something like that. Heat illness, if somebody's starting to act strange, sweating too much, or it's not sweating at all when they should be, nausea, dizziness, faintness. Hey, we got this heat illness problem. Get them cooled off, get them in the shade, get them plenty of fluids to drink. We just solved a bunch of problems with quick, easy, basic interventions and things that are easy to go out and teach to your community. If you joined us late, that was one of the things I started our talk with. Make sure that once you've got these, master these skills on your own. These are great skills that you can take out into your community, just like you do with fire prevention. Try to improve things for people that don't have access to good resources. Teach them the right way to take care of these things so they're not putting, toothpaste in a burn or something like that, right? Teach them these things. So there we go. That's today's class. I'm gonna um, wrap things up. We're going to open the floor up to some questions as we transition into our tea time. So if you've got a question for me, just hold on to it for a few moments here. Thank you, everybody, for coming. The screen's got my contact information there. Um, if you need to reach out to me, please do. I see lots of comments that say, "Hey, we want these slides." I'll get those for you. Go to our webpage where it's listed there, www.africafiremission.org. Up at either the top or the side, depending on the device that you're accessing it from, there's going to be a tab, some tabs, right? Hit that resources tab, go to the training materials, and you're going to find uh, there'll be a folder there, a link to a Google Drive folder. In that Google Drive folder, there will be a additional materials, right? There you can find recordings of all of our trainings. That's where you can go to earn a certificate for any trainings that you missed. So check that out. Lots of cool free stuff on our webpage. As I wrap us up for the day, let me just say, hey, thanks, guys. Thank you for coming. Some of you are on duty, most of you are off duty on your own time, using your own bundles to be here, learning about this stuff that you can take out to your community. You're trying to make yourself better, you're trying to make your community better. I love it. Keep it up. We don't take you guys for granted. Join us again next week. We're here every Wednesday. Share this with anybody you think can benefit from it. And hey, God bless you and have a great week. And we'll see you. Oh, let me stop my share here so you could see there's my smiling face one last time in front of you. Thanks for being here. Share the link. We got plenty of seats available. And if you've got time, stick around for tea time. Thank you all. See you again next week.